right? This is the physical assessment for HEENT, cardiovascular and pulmonary. My name is Gianni Mira. First thing I'll do is wash my hands, introduce myself to the patient, and get the exam started. First thing I will do is start at the top of the head. I'm going to inspect for symmetry, any bumps, lesions. Then I will pull apart the hair, looking for any lesions or deformities of any kind. Ask if the patient has any pain. Clear. Next, I'm going to check for visual acuity. Just gonna check your pupils real quick. Look at me. Straight ahead. Pupils are equal and reactive. I'm going to do a central vision test, which should be 20 feet away from the patient, but in this sense, this chart says 6 feet away. I'm going to ask the patient to cover one eye. Can you read the line that's most clearly visible? Try to read this line.
EFTZO.
Okay. Uncover your eye. Cover the other eye. Read the same line.
EPDHJB5.
Do both eyes uncovered.
DHJBS.
And try to read this line below it.
EPTZO.
Cover the other eye. Or one eye rather. Try to read the same line.
EPTZO.
Cover the other eye. Read the same line.
EPTZO.
Okay. Patient has 20/20 vision. Next, I'm going to check is for near vision. I'm going to have the chart 14 inches away. I'm going to ask the patient to cover one eye and read the clearest line.
CFDHJ.
Cover the other eye.
CFDHJ.
Uncover both eyes and read the same line.
CFDHJ.
Okay. That was a positive finding. Next is I'm going to do the confrontation test. Test cranial nerve 2. I'm going to stand 2 feet away and have the patient cover one eye. Okay. I'm going to cover my opposite eye. So she's going to cover her left. I'm going to cover my right. And I'm going to ask her to tell me when she sees my finger coming to her field of vision, testing her peripheral. Say now when you see it. Don't move your eye. Look straight ahead. Look at me. Focus on me. Say now when you see it.
Now.
Uncover your other eye. Cover your other eye. Do the same.
Now.
Don't move your eye. Keep straight ahead.
Now.
Okay, that's intact. Next, I'm going to test is the corneal light reflex. I'm going to stand 2 feet away from the patient and shine the pen light in the middle of both of the patient, in the bridge of the nose. And I'm going to look for equal reflection in both corneas. Look straight ahead. Look straight ahead. Okay, that's a positive. The normal finding. Next, I'm going to do is the cover-uncover test. I'm going to stand 2 to 3 feet away from the patient. And I ask her to stare at a target, which I'm going to hold this pen light so you can stare at this. And I'm going to cover, she's going to cover one eye and observe, I'm going to observe the uncovered eye. If the uncovered eye moves, then it's a negative finding. So cover one eye, uncover it. Okay, great, cover the other eye. uncover it. Okay. No, that was unremarkable. No positive findings there, or negative findings. Next I'm going to do is I'm going to just palpate the external structures of the eye. Sure there's no deformities or any lesions or any masses. While I'm at it, I'll get the nose. Test the ears as well, just because I'm in the area, so I don't have to repeat that. I'm going to look into your eye and check a cornea, an optic nerve, cranial nerve 2, the optic nerve, straight ahead. Okay. Corneal disc has defined borders. Arteries and veins are clearly visible. Arteries are smaller, the veins are larger. And there's nothing that is concerning of any kind of negative morphology. I'm going to inspect the patient's ears now. Back. Before I do this, I'll inspect the ear itself, the physical ear, make sure there's no deformities, lesions. Okay, I'm going to pull the peanut up and back. And I can clearly see the tympanic membrane. No exudate, no inflammation. Pearlish gray color. Look to the other side. I'm on the patient's right. I'm going to be holding the tool in my right hand. Pinky on the forehead, pull the ear back, inspect the ear for any deformities or any kind of lesions. It's good. Up and back. Same findings here. Next, I'm going to inspect is the nose. And ask the patient to hold their head back, slightly pull up, look at the membranes, pink, moist. Same on this side, no exudate, no tumors, no lesions. Looks good. Palpate frontal and temporal sinuses. Any pain? Okay. Next, I'm going to move to the mouth and throat. Inspect the lips. Stick out your tongue for me. I'm going to look at the side of the tongue for any lesions, because if there was any cancerous lesions, they usually start at the sides of the tongue. Can you lift your tongue up for me? All right, open up, say ah. All right, uvula is intact. Teeth, gums are all there. The soft and hard palate are intact, unremarkable. By making the patient swallow like I did before, I was checking cranial nerve number 9, glosopharyngeal. Also, number 10, the vagus nerve, is going to be tested by, and the soft palate actually, will be tested by saying ah, we already did that. And lastly, cranial nerve 12. I don't think I did this, but I'll do it again. Stick out your tongue. Stick out your tongue. Tongue is medial, does not deviate to either side. So that shows me it's intact. Can you push your tongue to your cheek? Do it again. Do it again. That shows that 12 is intact. I already observed the patient swallowing, so he's okay with that. I'm going to inspect her neck now and her thyroid. Inspect the swollen lymph nodes. None. Can you just go that way for me? So Inspect your thyroid from the back. I'm just going to gently feel for any nodules or deformities. You swallow for me. Okay, everything seems to be unremarkable. Just going over to see if I missed anything. Okay, that completes our HEENT exam. The next we're going to do is we're going to go over cardiac and respiratory. Let's make sure here. Okay. Right. Next thing I'm going to do is just inspect her breathing. You just take a deep breath in and out. Okay. Any restriction, any trouble breathing? Okay. Can you just scoot over to the side for me? I'm going to check for equal expansion of the rib cage. Placing my hands at the bottom of the last rib. Can you breathe in? Breathe out. Okay. Equal expansion. Okay. Slow it again. Inspect her trachea. Check for firmitis. Making the patient say 99. Say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
No firmitis noted. If you do the same, 99.
99.
Do it again.
99.
Do it again.
99.
Okay, that's tactile firmitis. That's negative as well. Okay. While we're at it, we'll listen to some lung sounds. Obviously, what has the patient? She has any trouble breathing? If that's what her chief complaint is, which if you have any trouble breathing,
No.
take a deep breath in, deep breath out, deep breath in, out, in, out, in, out, in, out, in, out. Deep breath in, out through your mouth, and breathe out and in through your mouth. I'm going to go side to side, comparing each side in this pattern. 1, 2, 3, 4, 5, 6. Actually, can you turn to the side so we can show what we're doing? Deep breath in, out, in, out, in, out, in, out, in, out, in, out. Lung sounds are equal and clear bilaterally. The next thing, while I have you in this position, stay there. I'm going to check for a diaphragmatic excursion. So I'm going to ask you to take a deep breath in and exhale and hold it. I'm going to percuss until I hear a dull sound. And that will indicate the bottom of the diaphragm, which is right here. I'm going to mark it. Take a deep breath in and hold. I'm going to percuss up until I hear, there you go, right there. Another dull sound, no resonance. And I'm going to measure the 2 points. And we have approximately 4.5 centimeters, which is within range of 3 to 5. You could breathe. Next thing I'm going to do is I am going to check, I'm going to visually inspect the chest or any kind of corium or JVD. So if you did lie on these pillows, ideally would be 30, 45 degrees. We're going to make it work here. And I ask the patient to look at the wall. And by doing that, I see the jugular vein not distended. Can you look the other way? Same finding on the other side. All right. Can you sit up again for me? I did forget one thing. I'm going to the diaphragm excursion. I have to do it on the other side. So if you could just do that one more time. And I'm going to do the same exact thing. So take a deep breath, blow it out, and hold it. Start mid scapula. This is on the right side, already to the left. All right, that's left right there. Mark that. Okay, breathe in and hold. Go up. Right there. Measure this side, make sure that it's even to the other side, and just approximately 4.5 centimeters. All right. To the pre-cording inspection, you lay back down. Usually for patients, either flat or left lateral recumbent would be ideal for this, but you can't always inspect it due to anatomical features, musculature, and cases like obesity. Examples, for instance. So I really can't see anything right now. So I'm inspection. I'm gonna bypass that, and I'm gonna go right to auscultation when I get to that later on. Okay. I'm gonna check for pulses. I'm gonna check for radial, bilateral present, ulnar, bilateral present, brachial, present, bilaterally, carotid. I'm gonna check one at a time so she doesn't pass out. Both bilateral present. Could also auscultate the carotid. And I'm checking for bruit. Goes drill, which is negative. While I'm here, I'll actually check the ape to man. So I will check the aortic, which is will be auscultated at the second intercostal at the right sternal border. To find that, I'm going to find the sternal notch, which is right here. I'm going to go down to point Louis, and it should be directly to the left. It should be right about there. Found that landmark. I'm going to listen. I'm listening for murmurs and irregular heartbeats. No positive findings. The next thing I'm going to do is check for the pulmonary. And that's directly to the left. Same position, directly to the left. Yes, that was the right for the aorta. This right to the aorta, left to the pulmonary. Same exact spot. Next to the sternal border. Sounds good. S1 and S2. Clearly heard. Herb's point is the third intercostal. Tricuspid is going to be the fifth intercostal. It's going to be approximately right here. That's going to be to the left of the sternal border as well. And lastly, we're going to check for the mitral, which is going to be midclavicular, fifth intercostal, left sternal border. time. Overall, looking for S1 and S2. Closing of the mitral and tricuspid valves. S2. The closing of the pulmonary and aortic valves, which are clearly heard. No murmurs. Now, I would ask the patient, depending on what she came in for, if she was coming in for any kind of arrhythmia or palpitations, if she felt it, how she felt it, when she felt it, how long did it last, what she was doing when she felt it, if anything made it better or worse. But she doesn't have any of those problems, thankfully. Next, I'm going to check when auscultate the aorta, and I should hear nothing. If I hear something, then it's an issue. But the aorta, the iliac, and the femoral, I will auscultate. So first is the aorta, which is between the bottom of the sternum and the umbilicus. Nothing heard there. Okay. Renal arteries. No positive findings, all negative. Femoral. Negative for the femoral. I will palpate the femoral, make sure they're present, which they are. I will check for the popliteal behind the knee, present. Present bilaterally, strong and present. Next, I will check for the dorsalis pedis pulse. Now present bilateral. Posterior tibialis, which is the inside of the foot. And also present bilaterally. According to this, just to make sure I didn't miss anything. That should cover our physical assessment for HEENT, cardiovascular, and pulmonary.